So let's talk about some of these epidemiology studies. And I want to be mindful
Mhm.
of your time, so just let me know when you have to jump off. Do you have
Yeah,
10
no,
minutes? Do you have to
I
go?
yeah, I got time. I can make more time. It doesn't matter too much.
Okay.
We can go over. Yeah, so the Oxford Epic is a study that I've promoted in the past as well, as a vegan, because of the sheer number of participants. I believe there are all UK-based people, and this is a huge number of people. Now, I don't know what the original number was when they started the study, and there are there's so many different papers on the same exact study, so it's hard to find the actual updated numbers, but it's one of the most cited for showing how vegetarian slash vegan diets are protective against all-cause mortality and cardiovascular disease and many different types of cancer, right? And I find that a lot of people in the nutrition space and also in the vegan health space, they favor epidemiology over a lot of different studies. And as most people know, if you've done a little bit of research into what different kind of study designs there are and their limitations, it's not too hard to find what the the holes could potentially be in these large epidemiology studies. And a lot of times people use these relative risk numbers as and make the mistake of just saying the percentage without saying what that means in context of the specific study and the numbers of people studied. So people will say vegetarians have a 15% less risk than meat eaters of developing heart disease or for all-cause mortality, and they just stop there, right? And it sounds like you're saving a lot of lives. If 15% less people in the world were vegetarian, they would save millions and millions of lives. But in reality, that is a relative risk versus absolute risk, which would be completely different. And I'm sure this is something that you've talked a lot about, but I think it's an important thing just to start there, because a lot of these percentages are a bit misleading for people who have never heard about these ways of analyzing statistics.
Yeah, and from the beginning, we have now shifted into the very dark, murky, muddy land of epidemiology. The first few studies we were looking at were all interventional. And just so people understand the difference, an interventional study is when you take a control group and an experimental group and you do something to them. You remove meat, you give them a low-fat vegan diet, or you add meat, or you cut calories. We talked about a number of interventional studies. As you suggest, it's been a point of consternation for me that most of the vegan and vegetarian proponent physicians that I've talked about will always revert to epidemiology, which is a very different type of study. This is a survey-based study. So it's important that people understand these words. So when they say here, it's a cohort study, meaning it's epidemiology. This is a prospective cohort study. It did have a lot of people. It had 48,188 participants with no history of ischemic heart disease, stroke, or chest pain, which is angina, right? And so what they do is they take those people, that's how many people they ended with. They probably started with more. They take those people and they give them a survey. And you actually sent me this survey, so this is really cool.
Once a year.
So they'll give people a survey, and they'll ask them in the beginning how much meat they eat, or they'll follow them over time and give them surveys every once in a while. And so there is no intervention here. There's no intervention. These are people living their life normally. They're getting a survey. Do you eat any meat? Bacon, ham, poultry, game, meat pie, sausage. This is the actual questionnaire from Epic, right?
Yeah.
And you noticed something interesting about this. What did you notice about this survey questionnaire, John?
Well, many things. I mean, first of all, just thinking about how this questionnaire is submitted once a year is already problematic, right? Because like how good do you think people's memories are in terms of how much of each food category and each kind of like subcategory they have eaten, and how many hours of cleaning they've done around the house, how many hours of exercise, and how many cigarettes they've smoked during the last 365 days. It's impossible to have accurate memory on this. So already there you can see a problem with, you know, the way that we're gathering data. It's not to say that it's garbage and we can't use it to some you know, advantage and to come to some hypotheses, but to use it as, you know, as a you know, promoter of truth and fact is really silly when you see these limitations. So how many, like, you know, it's not like people, if people were 48,000 people were logging their food into chronometer.com, and all of their nutrients were analyzed each day, you know, it would be a little bit different. But this, you know, they don't even specify sometimes if, you know, the yogurt has, you know, some sort of additives or sugar or anything like that. They just say yogurt, they just said bread, and, you know, different types of breads and that kind of stuff. And it doesn't really give us a really good picture, right? It's really limited. And also, in terms of, you know, what they actually, you know, scan for is how much they've you know, worked out and what type of meat, and they seem to be really hyper focused on how well you cook the meat and also what type of meat you're eating, if it's saturated fat or cholesterol, or you know, red meat or something like that. And they expect you to know the exact you know, amounts. And just think about for a second, if you're maybe struggling with self-esteem, or if you have a bad relationship to food and you finally decide that you're going to take control of your health and you're involved in this epic study and the questionnaire finally comes to your door, and you know that, you know, you haven't been too good in the last year, how likely is it that you are going to be so honest with yourself that you're going to write down the exact amounts of time that you had a cookie or a sugary drink or, you know, some sort of junk food? You know, you would be embarrassed to write down the truth that you had, you know, 14 meals a day that was processed. You would not write that, even if you understood that you are an unhealthy person psychologically, and, you know, relating to shame and guilt and these things. We can't rely on people's psychology to report accurate information about these things. And that is, I think, one of the main problems with this study.